There once comes a moment in your life when you have to decide your future employment. Whatever it is, it influences your life significantly. You have to develop new qualities and improve old ones to achieve your goal. And just like all of us, day after day, you climb on the stairs. Each step you take then becomes a foundation for a new one. And that raises a question of picking a right foundation for a step. That is quite actual question for young people like me. Me myself picked pharmacy as my next step. And it's time to tell what pharmacy means for me. But for the start, we need to define what pharmacy means. Pharmacy is known from the scientific point of view as the art and the science of recognizing, identifying, collecting, selecting, preparing, storing, and testing compounds, and dispensing all substances used in preventive or in curative medicine for treating people. The field of pharmacy can generally be divided into three primary disciplines: pharmaceutics, pharmacokinetics, medical chemistry, and pharmacognosy. Oh, and there is also pharmacy practice. The boundaries between these disciplines and with other sciences, such as biochemistry, are not always clear-cut. Often, collaborative teams from various disciplines, pharmacists and other scientists, work together towards the introduction of new therapeutics and methods for patient care. However, pharmacy is not a basic or biomedical science in its typical form. Medicinal chemistry is also a distinct branch of synthetic chemistry combining pharmacology, organic chemistry, and chemical biology. So, pharmacology is sometimes considered the fourth discipline of pharmacy. Although pharmacology is essential to the study of pharmacy, it is not specific to pharmacy. Both disciplines are distinct. Those who wish to practice both pharmacy, patient-oriented, and pharmacology, a biomedical science requiring the scientific method, receive separate training and discipline. Pharmacoinformatics is considered another new discipline for systematic drug discovery and development with efficiency and safety. Pharmacogenomics is the study of genetic-linked variants that affect patient clinical responses, allergies, and metabolism of drugs. Pharmacy is old as the world itself. The earliest known compilation of medicinal substances was the Sushruta Samhita, an Indian Ayurvedic treatise, attributed to Sushruta in the 6th century before Christ. However, the earliest text as preserved dates to the 3rd or 4th century Anno Domini. In ancient Greece, Diocles of Carystus, 4th century BC, was one of the several men studying the medicinal properties of plants. He wrote several treatises on the topic. The Greek physician Pedanius Dioscorides is famous for writing a 5-volume book, De Materia Medica, concerning medical substances, which was used as a basis for many medieval texts and was built upon by many Middle Eastern scientists during the Islamic Golden Age, themselves deriving their knowledge from the earlier Greek and Byzantine medicine. In Russia, pharmacy started to develop in what we can see today during the reign of Peter I. These times, there was a great need in widespread and cheap but qualified medical help. Any plans connected with this demand couldn't be completed without the same widespread medication distribution network. Pharmacy order and then main pharmacy collegiums were in charge of building such network. The laws were corrected, thousands of drugstores were built, and even more pharmacists were trained and called from abroad. Then, after a bit longer than a century, self-sufficient pharmaceutical industry was built in Russia. Well, that's enough for history. Now let me tell you why I've picked pharmacy as my future employment. Pharmacy comes from the Greek word pharmakon, which literally means a drug in a modern language, and nowadays we commonly think of pharmacists as the people who keep drugstores in order and dispense drugs, or as lab coats doing different drug analysis. That did not make any difference from my view on this profession. I have always enjoyed studying chemistry and biology. I knew botany and economics on a school level, and when time came to the point when I had to decide my future job, I've chosen pharmacy because Confucius once said, Choose a job you love and you'll never have to work a day in your life. From that point, this became my dream. I realized that I would need to work hard and face with different challenges on my way to apply to the medical university. But life is kind of boring without challenges, I thought, and if I couldn't solve problems even like these, I wouldn't even think about such a dream as working as pharmacist. After exams, I finally applied to PIMU on pharmaceutical faculty and was successfully admitted. Since that time, I have been studying here for almost 10 months. What has changed? Well, except things I really liked about study and the city, such as cultural places and tutors at my university, I faced with even more challenges that I couldn't think about because of my youthful innocence. I had to move to another city alone, almost without help. Other subjects on my faculty appeared to be much harder than I had thought. My timetable became as tight as possible, and there appeared much more minor problems. On the other hand, living in a university hostel almost without anybody's help made me more independent. Though other subjects were hard to learn, but most of them made me interested either in a subject or at least in something new for me. With the lack of free time, I finally began to do proper time management. It has been challenging to live these 9 months, but they taught me to constantly progress. So, in conclusion, what does pharmacy mean for me? A great opportunity to challenge myself. An opportunity of unstoppable development and never-ending knowledge. And last but not the least opportunity is my desire to help people. Well, in the end, after all things I have experienced, I guess I have chosen a job which is appealing to me no matter what happens.